I am talking about building a data-driven hospital. This is the vision, to have a hospital unit that's based on data, because we all talk about AI. We had a lot of talks, and it's an important topic nowadays, but the foundation for all of that is that we have solid, good data that is accessible, and that's why it's important to have a governance structure, to have data integration, and to use this data for decision support, either while treating patients, but also for other procedures that have to be done within the hospital. For those who've not met me during the last 2 days, some information about me. So my name is Christoph Polkowski. I'm not only Deputy Chief Medical Information Officer of the University Hospital, but I'm also still working as a physician, as a senior physician at the Institute of Neuroradiology. So I'm a medical doctor, but I'm also a medical coordinator within the Department of Medical Information Systems and Digitalization. And also I'm taking care from the medical side for the Data Integration Center of the University Hospital in Frankfurt. The department I'm working for is a part of the University Center for Digital Healthcare. We founded in Frankfurt, but I will come to that later. First of all, I was talking about data, especially we are talking about health data. So what is health data? There's this definition in the GDPR. Data concerning health means personal data related to the physical or mental health of a natural person, including the provision of healthcare services which reveal information about his or her health status. This is the data protection definition, so there are different definitions probably. But an important point we were talking about yesterday is that is the question, who's the owner of the data? Is it the patient, or is it the hospital? Is it the insurance company who pays for the data? And how can you transfer data? Who can use it? So there are many questions that arise from the simple foundation of data. So you need governance structures. Health data can be different data. So here's some examples. If you go to the dentist notes can be health data. If you go to the hospital, you get a CT scan, as I work in radiology. Concerning AI, I'm an endangered species. Everybody thinks we don't need any radiologists so far, but we still need them, and they produce a lot of data. The imaging data is increasing every year. So radiology reports and images can make a huge amount of data stored in the hospital. But also information about treatment appointments, if they are patient-related or disease-related, can be health data, medication prescriptions, or information about or from medical devices. And why health data area? So this is a bit a word era that is often used to underline the importance of something. In this case, health data era is chosen because we have an increased data collection. As we have seen during the last days, more and more hospitals are digitizing their procedures. The electronic health record in the hospital is gaining more information. We get information from laboratory, radiology, and other departments. Pathology is digitizing. So the data collection is increasing. We heard about the increase of data in total that is evaluated. Also, the healthcare systems are increasing. There are more structures. We know in Germany, not everything is increasing. Many hospitals, they close their doors. But nevertheless, the demand for medical treatment is increasing as the population is aging. There's more digital maturity. That's why we are here. We are talking about digital products and solutions for our problems. And if there are new products, we have more data that's coming out of it. There's a need for data utilization. I already mentioned that the population is getting older. We have a shortage of healthcare workforce. So we have a need also to use these digital helps. And as an example, data from wearables, we will have more sources, maybe in the future, sources we do not know about so far, but that will create new data. We've heard during the last days, yesterday and today, about new devices that can bring up information, for example, from blood samples. We heard from the product, from the talk about from your company from Finland. The amount of health data increases, and the problem about it is the data comes from different sources. So there are doctors' practices, there are hospitals, insurances, industry, wearables. So they have their own space where they store their data. They have their own standards, and it's not easy to access all this data in a standardized format. And as I already mentioned, there are different data formats. So that's something we have, especially in the industry, that many companies want to sell not only their product, but they want to sell other products that are related. And so they have their standards so that they can use, their data can only be used with their products. And therefore, it is sometimes difficult to bring different solutions together and to get the information from different sources into one central information system. In the University Hospital Frankfurt, we try to bring all information in our central health information system, but as you can imagine, and as you heard also about from other hospitals who are introducing a new health information system, it is not that easy. So there can be different data formats from all these devices and sources, and the chances to standardize them, as we also heard from the European Union, that this has standardized the USB cable for charging, and in the future maybe we will have standardized formats and interfaces for all these sources and for all these use cases. The primary use of health data is patient treatment. I still work as a medical doctor, and what we want to do is use this data to have a best outcome for our patients, to treat them so that they stay healthy or they get healthy or they don't have a good life quality. But it's not always easy to have all this information combined so that we can align our treatment in the best way. So we need to bring health data from different sources together, combined on a patient level, and that's also the idea of the central electronic patient record that is being introduced right now in Germany. And we still have it in my daily experience that people come with a big binder of documents, put it on the desk and say, "So this is all information about my medical history. Now please help me." And we don't have the time to go through all these documents. We have some ongoing projects in the university hospital where we want to scan documents and label them, because the labeling that is done is not always correct. So it's not always a doctor's letter that is labeled as a doctor's letter in the system. And we want to label them automatically, and we also want to get a short summary of these documents. So this is, for example, one of our projects to help improve patient treatment. Every patient produces data. That's why we have a huge amount of data. So we use this data, as I said, for the primary use is to improve the outcome of each patient, to have a better patient treatment. But this data can also be used for other reasons. And then it's not used on a patient level, but it's combined. In this case, I've combined it as containers, or how you define them as data sources. And there are different reasons why you want to use this data. There's research. As a university hospital, we have to do research, and we want to do research to improve patient outcome in the future, not on a patient level, but on a society level. There's quality management, so we have to look at our processes, at our treatment, if the process is the right process to treat patients, or if you have to change anything. We need it for administration, because we have to earn money. We have to get money from the insurance companies, and therefore we need to send them data. And we need it for innovation, as we are here today also for the contact with industry partners and other stakeholders to create solutions that help everybody. The problem I already mentioned is the data, health data is stored decentralized. So doctors practice X, hospital Y, and insurance Z, and company A and app B have different locations, different storage, different data. And so it's difficult to use all this data. So we have to go, in our case, on a hospital level to look what we can do with the data we have in our hospital systems to use it for our purposes. The idea is in the future that we can go to regional, national or European level, but so far we have to focus on the data we can access easily within our hospital. But even within the hospital, in the University Hospital Frankfurt, as I said, data is not centralized. We try to centralize all the data in our health information system, so in the electronic health record of each patient. But nevertheless, we have radiological data, we have laboratory data, clinical data, tumor documentation, and there are many subsystems, and the number is increasing as we have digital pathology right now, and as we are trying to introduce AI tools, for example, to improve image recognition in radiology or image recognition in pathology. So, as many other university hospitals in Germany, we have the data integration center. And as I said in the beginning, I'm in charge from the medical side for the data integration center in Frankfurt, but we also have a lot of medical informaticists that take care of getting data from all these different sources for the reasons I told you before. We need it for quality management, for controlling, and especially for research, as we are doing research projects in different fields. And nowadays, it's not that you can do research with a Excel table with a small amount of patients, but you need big numbers, especially if you want to use artificial intelligence, for example. Our aim and what we are building up is what we were also discussing today at the roundtable discussion is a user-independent, interoperable platform, a platform that brings this data together so that it can be used for different purposes. Ideally, it will not only bring the data out of the hospital, but also bring data from different sources into our hospital systems. And here, as an example, what probably will be the standard for exchange in the interfaces is the HL7 FHIR standard. So we try to standardize these interfaces to connect with other data hubs. The Data Integration Center, the Department of Medical Information Systems and Digitalization, is combined in the University Center for Digital Healthcare. Since 2021, we have this university center to combine these different aspects we have when we are talking about digital health. We need the infrastructure, we need software, hardware, we need the strategy, project management, and so on. And that's the idea of building this university center. We want to have digital healthcare, so technology in the service of people, efficient, safe, and patient-centered. We want to use it as a foundation for transformation. We heard a lot about change management and transformation management. We want a future-proof IT infrastructure with highest security standards and interoperable systems. And we have the vision of a smart hospital that is modular, scalable digital solutions for interdisciplinary collaboration. We aim for interoperability and innovation, standardized processes for seamless digital integration, and we want to have networking and service, so digital platforms and AI-supported tools for optimal patient care. So this is the aim, why we have the University Center for Digital Healthcare, and we are working on it. There are 4 pillars within the University Center. There's the Institute for Medical Informatics. They are taking care healthcare, especially about research topics concerning digitalization. We have the Department of Medical Information Systems and Digitalization, where we have the strategic part, and where we have also the user part, where me as a doctor can say what we need for the daily routine. We have the Department of Nursing IT and Innovation. We also have a lot of different workers that aren't doctors, especially nurses are the biggest group of employees within the healthcare, within the hospital. So they have their own department within the University Center for Digital Healthcare to have also this user side within the boat. And the Department of Information and Communication Technology, this is the IT department, because we need IT to run all our projects, because the best strategy doesn't work if you don't have the people who are working on the software, the hardware, and who do the project management. Within the University Center for Digital Healthcare, we also have core facilities, because there are topics that are not placed within one of these pillars, but that concern different pillars and the whole hospital as itself. There's the trust office, in German Treuhandstelle, that is needed to have this. So far we use it for consent processing, because we have a broad consent to ask patients if they give their if they accept that their patient data is used for research purposes, and that we can share the data with other hospitals. And therefore we need this trust office, but in the future we want also to use the trust office for pseudonymization and anonymization of health data. We have a core facility, artificial intelligence, as this is an important topic that will be even more important within the next years. So we have to cope with this topic. And therefore we have a core facility that's taking care of the regulatory aspects concerning AI, especially now that we have the new EU AI Act, or so new, it's not so new, but we have to cope with regulatory tasks. There's IT project management, and there's also the data integration center I already told you about. We need to have people that integrate our data so we can use it. So this is about the governance. This is an example of one of our projects. It's called OneView Med. And within this project, we have the use case that we have two different systems for the treatment of patients within intensive care wards and normal wards. So Orbis, which is our health information system, and MetaVision, which is the system that is used to have medication, allergies, vital data from intensive care patients. And usually and hopefully, patients from intensive care ward can be transferred to a normal ward after some time. And then we have this problem that the patient arrives at the department, at the ward, but the health information is still in the other system. And there are interfaces, but what we also learned during our roundtable discussions, that it's often difficult to have the right interface for all your programs. So we created a dashboard that's integrating data from both systems, so that the people who are in charge of treating these patients have information from both systems and can act more precisely and quicker than it was the case before we had introduced this system. So this is still a proof of concept, but the aim is that to have dashboards and information systems that are also used for patient treatment. Another project is the project called Susan. It's a project that's concerning antibiotic stewardship. So with patients with infectious diseases, we need to give antibiotics or anti-infective medication. But they have side effects, so we don't want to give them too long and too much. And if we give too many people too much anti-infective treatment, they will have resistances. So we will have a problem. That's why we need antibiotic stewardship within hospitals. And there are many also different data sources It's the data from the pharmacy. It gives us information about the usage of anti-infective medication. And there's also the data from the patient side about their diseases, about their infections, about their bacteria they have. And we have to bring this data together to find the best way how to treat patients with infectious diseases. And within this project, we also created dashboards for the team of the antibiotic stewardship team that consists of doctors, specialists for infectious diseases, employees from the pharmacy department, from the and from other departments, from microbiology, to bring them together and to give them the information from these systems to increase the quality of their decisions and increase also the speed of their decisions. We can go down to a department level, to a ward level, and we can also use the data and extract it for different times. But that's also still in progress, so we are building up this project as one of our many digitalization projects. One of our projects that is also being built up is the hospital command center. That's our vision, to have, like we heard about it yesterday, a hospital command center to integrate our data, not only to treat patients, but also to improve the quality of our procedures within the hospital, and to have a better outcome. And not only have a better outcome on a patient level, but also increase the workflow and the processes. And what we are also working on, and also this is a vision, how we can use data, is the digital twin. This is a buzzword that's often used, but the idea is to have this data integrated in one model of the patient and also digital twin of the hospital, maybe in the future, to use the data to have prognosis for outcome of diseases on a patient level. These are examples for the use of data in the hospital so far and how we want to use it in the future. But we also want to use data. We use data on a regional level. For example, in the past, we used data in a study or in a project called ProsRemot. It was a prospective management of regional resources based on mathematical modeling in the case of seasonal disease outbreaks. So this was a project that aimed on looking how many beds, for example, do we need if there's a influenza or COVID outbreak, and how to cope with these special situations on a regional level that go beyond the walls of one hospital. As I said, we also want to use data on a national level. The Data Integration Center is part of the Medical Informatics Initiative in Germany, and the Medical Informatics Initiative is combined of mostly university hospitals in Germany that exchange data to use this data for research purposes. And there are more and more structures that are built up, so we can use, for example, also radiology data. That was a project that was brought up during the COVID pandemic, to have a look on CT scans that were made from patients who had COVID. And for an outlook on the future, we heard about the European Health Data Space, and the European Health Data Space is not the near future, but will be the future one day. And the idea behind it is that individuals should be given control over their health data. The exchange of data for the provision of healthcare services across the EU should be facilitated. So if you change the country, the health data can change with you in the best case. So this is the one side of the European Health Data Space, and the other side is the aim to provide a consistent, trustworthy and efficient system for the reuse of health data for research, innovation, policy making and regulatory activities. So we also have this two parts, the primary use of health data and the secondary use of health data. So this is an outlook on how things are developing using health data in the hospitals and beyond. And I'm happy to sit down together for a last roundtable discussion. And thank you very much for your attention.